Today let's learn a little bit about dengue fever in children. So dengue is a mosquito-borne viral disease that is endemic in India right now. It is caused by viruses of 4 serotypes, dengue 1, 2, 3 and 4. It is spread through transmission from the bite of an infected female Aedes aegypti mosquito. These Aedes aegypti mosquitoes are day breeders and they bite during the day. So they are present mainly in densely populated urban spaces where clear water storage is done, like in flower pots, AC drains, etc. So dengue in children is in 3 main phases. So one is the febrile phase in the first 2 to 7 days, and then is a critical phase which lasts for 24 to 48 hours, and then there is a convalescent phase which lasts for about 2 to 3 days. Coming to the febrile phase, this is seen as a very rapid high fever spike in children that can go up to as high as 104 to 105 degrees Fahrenheit. This fever is associated with abdominal pain, nausea, vomiting, diarrhea, bleeding from either the gums, mouth, nose, or blood in the vomitus or blood in the stools. It can also cause muscle pain, pain behind the eyes, and joint pains. These joint pains can be so severe that dengue has earned the nickname of break-bone fever. Coming to the critical phase, this starts after about 2 to 7 days of the febrile phase when the child starts becoming afebrile. So this critical phase is characterized by leakage of the plasma into the extracellular spaces like lung spaces or into the abdomen, which can cause breathing problems in the child or abdominal distension or stomach pain, and also cause hypotension or low blood pressure. This critical phase is when parents should definitely visit the hospital with their child when any of these warning signs and symptoms appear. So some of the warning signs and symptoms are if the child is irritable, drowsy, lethargic or listless. If the child has severe vomiting, that the child is not able to accept any oral fluids or feeds. If the child has severe vomiting, that there is blood in the vomitus or blood in the stools. If there is severe abdominal pain in the child, or if the child has a rash all over the body appearing as small dots that do not blanch when pressure is applied. So after 48 to 72 hours of the critical phase, the child goes into a convalescent phase which lasts for about 2 to 3 days. Close monitoring of the child is required even through the convalescent phase. Diagnosis of dengue is done in 2 ways. One is the dengue NS1 antigen, which is a viral glycoprotein that is present in an infected child's blood. So this comes positive in the first 4 days of fever. So when the child presents after the 4 days of fever, something called as a dengue IgM ELISA is done, which shows up after 4 days of fever from day 5, can last up to day 60 of illness. So can show a recent dengue illness also. So treatment, as with any other virus, there is no specific treatment for dengue, and treatment is only supportive and symptomatic. The child should receive adequate hydration, breastfeeding should be continued, and plenty of oral feeds and fluids should be given. Oral rehydration solutions, fruit juices, if the child is able to accept orally, can be given. Fever should be reduced through antipyretics. Paracetamol is the mainstay of treatment for fever and can be given every 4 to 6 hours along with tepid sponging. Antipyretics like ibuprofen should be used with caution as they can exacerbate the gastritis that is already present in the child. And warning signs and symptoms when the child should present to the hospital, as mentioned above, when the child is not able to take any oral feeds or fluids, or is drowsy, lethargic or listless. You should always bring the child to the hospital. Prevention is better than cure for dengue, so always have personal protection against mosquito bites by wearing full clothes and mosquito nets, repellents and coils, and make sure there is no space for the breeding of mosquitoes, like clear water should not be kept. They should be emptied, cleaned or covered. Thank you.